In Canada, an outpatient program treatment centre enrolled 10 of their most consistent clients in a 12-week pilot program with us, Mendability, to see if sensory enrichment could help their brains compensate for addiction. Sensory enrichment therapy is a human adaptation of the research done with animals in the area of environmental enrichment. In animal labs, rodents show significant changes in their addictions and in their behaviors when exposed to environmental enrichment. Our program has been clinically validated with children with developmental disorders. So, could we apply the same techniques to support the treatment of addiction? In this outpatient program pilot, we measured improvement by asking these 10 clients to rate themselves on a scale of 1 to 5 in 10 questions, 1 being severe problem and 5 being not a problem. All clients had been stable in their symptoms and were all attending their other treatment appointments regularly. The questions were time spent in fantasy thinking about the reward, relief or escape, experiences withdrawal symptoms, cravings for the substance or compulsions to act out, neglects work, home or relationships, dependent on the behavior or substance as a way to cope, addiction leads to hazardous situations, feeling overwhelmed with shame, comparing themselves to others, trying to seek validation from others, feeling disapproval from others. We asked the participants to rate themselves before the program started, at the end of the 12-week pilot, and we also asked them to rate themselves 6 months later to see if the improvements, if any, would stick. At the end of the pilot, we divided the cohort into a low participation group. There were 4 of them, and a high participation group. There were 6 people in that group. The low participation group acted as a pseudo control group. This is graph 1 with the baseline scores. Graph 2 adds the scores at the end of a 12-week pilot. And graph 3 adds the score 6 months later. And you will see that not much change for the low participation group. If anything, the trend was a downward trend. Now, let's look at the results of the high participation group. Graph 4 shows the baseline scores for them, and you will see that their baseline scores are consistent with the low participation groups. They showed similar levels of addiction. In the next graph, we add their scores after 12 weeks, and you will see significant changes in their scores. Many of the questions are now in the 4 to 5 range, between maybe a problem and not a problem. And this is huge. Remember that this took place by doing 5 minutes of sensory enrichment protocols at home each day for only 3 months. But for many of us involved in a project, the big question was, yes, sure, but does it stick? And the next graph should help give an answer. And in many areas, not only did the improvement stick, but 6 months later, they continued to feel better. When we interviewed the clients after 6 months, most of the participants in the high participation group revealed that they continued with some of their favorite protocols from the 12-week pilot. And in their own words, here's how they describe how it feels for them. I knew if I did the exercises, it would shorten the amount of time I would have to listen to my disease. I feel finally connected to myself. I can relax now. I have tools. It appeals to my desires as an addict for instant gratification. I'm instantly relaxed and content. It's a gift to myself. Now, this is not a clinical trial. This is just Mendability and an addiction treatment center gathering data. But the results are really compelling. And if there's a research team out there interested in doing a clinical trial with us, please look this up. Please send an email to kim@mendability.com.